Patient Access, this is Cam.
The Patient Access Department at Boulder Community Health, we serve a really important role. We're usually the first face of a hospital, so providing that positive experience for the patient at the beginning, whether that's at registration when we're checking them in, or through the call center when we're scheduling the patient.
Imaging scheduling, this is Stephanie. How may I help you?
Women's imaging actually also reports up through Patient Access, so we have registrars that actually sit down in the women's imaging area and register for services. Patient Access also has financial counseling, so with that area we're actually meeting with patients and helping them understand their insurance coverage, or if they don't have insurance, we're actually coupling them with possibly charity care or Medicaid or the exchange.
And about a year ago when we moved to Foothills, we set up our patient queuing system, which is this is our kiosk. Patients queue in under whatever they're here to be seen for, whether it's surgery or cath or imaging, and it puts them in a queue so that we can call them to the registration desk according to what they're here for. When we didn't have the kiosk, we had lines. People were literally standing in a line waiting to register. So our goal is to have a less than 5-minute wait, and we've been able to do that for the whole time we've been here.
It's very simple, and it's nice to check in and be seen very quickly.
This is bedboard, and what we do here is whenever a physician needs a patient admitted somewhere in the hospital, they tell us the information, we contact the floors, work with the staff to help make sure that patients end up in the right place.
So I'm not as visible as some of my counterparts, but I am responsible for the registration, bedside registration of patients that come into the emergency room.
Here we're at our Foothills site. We register everybody that's coming in for lab work. So we see anywhere from 200 to 250 patients a day. It's our job to make sure we have all their demographics correct, their insurance correct, we have the correct provider in their registration, and we also want to make sure that we have the diagnosis codes. Down in our processing site, we see anywhere from 200 to 300 specimens a day, and it's our job to register everything that's coming in from doctor offices. So anything that they've drawn or collected at a doctor's office will come down to the processing site to be registered, and that's our responsibility to get that done. We have lab registrars here, we have lab registrars at BMC, Boulder Medical Center, and we have some at Boulder Medical Center East out in Avista Hospital.
So I'm DJ Sheehan, I'm the PreService supervisor and Patient Access, which kind of involves scheduling, insurance verification, and financial counseling. So anything you get done before you actually come in for your exam is what we kind of take care of here. So we've reduced our hold times from I think about 10, 11 minutes last year. In the last few months we've gotten it down to, we pick up this phone in about 15 seconds is our average speed of answer. And so we're doing a better than industry average on that, and we want people to want to come here and not be frustrated trying to get here. On top of that is also, patient care, making sure people aren't having to wait longer than they have to come in for an exam that may be a timely matter.
So training is an important part of patient access to get our staff comfortable with the different workflows, to feel confident when patients have questions, to be able to have accurate information when we're checking our patient in.
So the Patient Access Department really has a lot to be proud of. We've really become more efficient. We've reduced our wait times across the board. We're nationally recognized for our point of service collections program. So we've really focused on efficiency, but also being thorough. It's not just even the work that we do, but the people and just the environment is just really fun. It's kind of a family feel.